Our episode today is brought to you through the generous sponsorship of Napo Pharmaceuticals. And Napo Pharmaceuticals creates novel medications with a dedication to environmental sustainability. Check them out at napopharm.com.
Today's episode is titled An Unspoken Truth About HIV. You are not going to believe what we learned and are excited to share with you today as we recognize World AIDS Day, a time to step back and reflect on the many people who are suffering around the globe.
We have an unspoken truth to share about HIV as we do celebrate World AIDS Day. This is a truth that, once understood, can improve the lives of many adults who today are living with HIV. And to talk about this handsome young gentleman sitting here to my left is a true friend of the dose, Jeremiah Robinson. He has dedicated his life to the primary care of people like us, gay peoples. And he is a physician assistant at Elysium Primary Care here in Atlanta. We just want to welcome you back, Jeremiah.
Thank you guys. I'm glad to be here.
Awesome. What some of you may not know is that Jeremiah has been instrumental to the Gaily Dose message getting to our audience. He has helped us get two of our major financial sponsors, both focused on the healthcare of our community.
Wow, thank you. I love your all's mission here at the Gaily Dose, and I love what you guys stand for. Anything I can do to help you guys, to help you elevate that message, I'm on board.
So Jeremiah, it's been a while since we've had you back on the show. Thank you for coming back today. We wanted to learn about the unspoken truth regarding HIV. Let's get the cat out of the bag. What is the truth, Jeremiah?
Poop.
Poop? Like poop?
Poop.
Okay.
Well, it's not actually a laughing matter. You'd be really surprised, I think, to learn a few things about it. I mean, first off, 20% of adults living with HIV have chronic diarrhea.
Wow. I had no idea. And you're sure it's like chronic diarrhea?
I get that a lot, that reaction, because most people have no idea that it's that big of an issue and just how common it is in people living with HIV. And what exactly is diarrhea? It's basically when stool is loose, watery, or unformed. And chronic just means that it lasts for more than a month. But the diarrhea can be once a week, once a day, multiple times a day. And sometimes people think that this is normal or accept it as their normal. And it's not, or it doesn't have to be.
That's so bizarre to me. Like, what causes it?
Well, diarrhea can result from a few different causes. But when people living with HIV are experiencing it chronically, and it's not caused by another infection, it's likely related to the HIV itself, which damages the gut. So in clinical terms, we call this HIV enteropathy. HIV results in chronic inflammation that can activate your immune system, and it leads to diarrhea.
So HIV basically destroys your intestines.
Well, during the acute stage of the HIV infection, virus is rapidly spreading throughout your gut lining, and it immediately targets the CD4 cells, and it damages the tissue barrier between your intestines and bloodstream. That's what eventually leads to what we call a leaky gut. Okay, so with the leaky gut, that's where bacteria and toxins leak through the damaged intestinal tissue and it enters your bloodstream. And once it does that, it triggers this crazy inflammatory response. But this can result in people living with HIV who are experiencing chronic diarrhea once a week or daily, or like I said earlier, even several times a day. And what is challenging is that people can live like this for years, and some people never even bring it up.
Gosh, I mean, that would be so hard for a person. And it seems like you could just silently suffer through this. And your friends don't even know.
Right.
I wouldn't know.
Yeah, I mean, you might already be embarrassed about this, but you might also be afraid of being rejected even more, right?
Yeah, and people with HIV already have a huge stigma in the gay society that we live in. And on top of that, then that's ouch.
Yeah, I see that a lot in patients who don't even talk about this with their provider, and they may have already accepted this as their way of life or as their normal. Many people feel that they've tried everything. They've failed to manage their diarrhea on their own or with over-the-counter treatments, older medications, dietary changes, and not necessarily realizing that their healthcare provider could actually offer some solutions. So as a patient, listen up, as a patient, you have to be your own advocate. you have to bring these things up. Don't always assume that your provider is going to ask you those questions. It's a real issue.
Yeah, I have learned for sure that I can't wait for my healthcare provider to tell me things. Not all providers may know gay health and be in tune with the latest standards of care. And there's so much for them to know. I mean,
someone might actually be afraid of rejection from this in terms of finding a partner to accept them as they are.
I mean, living with chronic HIV-related diarrhea can impact a person. Living with HIV on so many levels, whether it's in their jobs or where they may not be able to get away to use the bathroom, or maybe it keeps them from going out and experiencing life. And yes, as you pointed out, Helmut, in their own home and in their personal relationships, it's common for individuals to struggle with mental health, I think, along with any physical illness, regardless of its nature. But as you can imagine, chronic diarrhea can impact all facets of the lives of people living with HIV.
So what can you do to address this issue?
yeah, I mean, I want to know how to approach my friends and want to advise them if they're struggling with this.
Yeah, well, there are a few things that we can do to help. First, if you can, try to see a gay-friendly healthcare provider, someone who treats HIV and understands that this is an actual issue with individuals living with HIV are facing. Your healthcare provider should understand that the issues that these individuals living with HIV may face beyond their CD4 counts, beyond their viral loads. There's a lot more to HIV care than just those two things. So they don't have to be an infectious disease specialist or a gastroenterologist, but what they do need to be, who they do need to be, is someone who is knowledgeable in treating patients with HIV.
Yeah, that makes a lot of sense to go to someone who knows what they're doing with HIV.
Right, and second, if I may, talk to your healthcare provider about your bowel movements. Just do it. How frequently you're going, how urgent they are, how loose, how watery, and for real, it's important to talk about these things. Talk about anything and everything with your provider. Trust me, we're so used to talking about stuff like this. It's really not that big of a deal. Loving yourself is speaking up for yourself, and that means bringing up these concerns with us.
That makes total sense. I mean, we have a lot of unnecessary shame in our culture around so many things. And loving yourself is speaking up for yourself with your provider.
I cannot stress it enough. It really is your responsibility. It's your responsibility as a patient to advocate for yourself.
I could even be better about that.
Yes. And then third, let me just say, to wrap that up, I think it's important to listen to your healthcare provider and to follow through with any recommended tests and treatments they may offer. This is what helps to rule out that other things aren't going on, and be able to get you the help you need to fix or improve what is happening. You also want to update us on your treatment progress. Let us know how it's going. Let us know if you're seeing improvement or not, if you're having side effects.
Yeah, I mean, okay, so is there something specifically you can do to treat this?
Well, there is. There's only one FDA-approved drug called Mytesi, and it's indicated for the symptomatic relief of non-infectious diarrhea in adult patients with HIV who are on antiretroviral therapy.
You said Mytesi? How do you spell that?
Mytesi.
Okay, so I think I heard you say Mytesi is for 1, living with HIV/AIDS, 2, experiencing diarrhea not caused by an infection, and 3, you're taking an antiretroviral therapy, right?
That's right, Jake. And remember, you must be an adult, 18 years or older, because Mytesi is made for adults. And to know if Mytesi might be a good fit for you, talk to your healthcare provider first. They'll need to run provider. I can't say that.
Provider, I love
provider.
That. Provider.
That perverted healthcare provider.
Perverted healthcare provider. To run certain tests just to make sure that these you're not having other causes of chronic diarrhea, because sometimes you may have bacterial infection, a medication side effect, or food sensitivity. It's also important to note that Mytesi is not approved to treat infectious diarrhea. If infectious diarrhea isn't ruled out, there's a risk that patients with an underlying infection will not receive the appropriate therapy, and that could just make the infection even worse.
Mm-hmm. So, how does Mytesi work?
So, good question. Your GI tract maintains this balance of salts and waters, and It's the balance that what allows for normal stool formation. Well, the damage HIV causes to your gut, which we discussed earlier, can result in this imbalance of the salts and the waters in your guts. Mytesi works to restore that balance of the salts and the water in your GI tract, leading to the decrease in diarrhea.
You know, that's really good news to know. There's a drug to help people with this. How do you take it and how quickly can you see those results?
Mytesi is a tablet that you'll take twice a day. You can take it with or without food. In a recent clinical trial, after 20 weeks, they found that 9 out of 10 patients had fewer watery stools and over half had no watery stools. So, it takes a little time to work, but results can be pretty darn remarkable if you hang in there.
Yeah, I mean, 9 out of 10 is a really great result.
Yeah, and I'll say that Mytesi does this uniquely from other drugs. So unlike some of the more common antidiarrheal drugs, which we call anti-motility agents, that basically work to form normal stool by slowing down the movement or the motility of your GI tract, Mytesi works to normalize the water flow in your gut. So there's a low risk of constipation.
Okay, that seems pretty simple, but can it interact with other drugs I might be taking?
Well, since it directly acts on the GI tract, it doesn't travel through the whole body. So in clinical studies, it hasn't been shown to interact with other medications. It hasn't been shown to affect your viral load or your CD4 counts.
Okay, so that's like a wonderful development for all these people, like honestly, who've just been suffering.
Yeah. Well, and a little known fact about Mytesi, it's the first oral botanical drug approved by the FDA. It's derived from the sap of a tree found in the Amazon. And for every tree harvested, they've planted 2 new trees. So I think now they've planted over 1 million trees to date.
Is there any help for people who can't afford this?
Sure. There's the patient support program called NAPO Cares, and they offer various services for eligible Mytesi patients, such as copay savings. They can help with out-of-pocket costs. So you can check them out online at napocares.com.
So, like all drugs, it must have some side effects, right?
Well, yeah, of course. In fact, I should mention the most common side effects from Mytesi are upper respiratory infections, sinus infections, throat infections, bronchitis, swelling in the tubes that carry air to and from your lungs, cough, gas, increased bilirubin. It's comparable to taking a placebo, like just taking a fake pill. But, for a complete list of side effects, talk to your healthcare provider. Tell them if you have any side effect that bothers you that does not go away. Tell them about any prescription or over-the-counter medicine or herbal supplement you might be taking before you start Mytesi, okay? So you can also read the full prescribing information for Mytesi at mytesi.com.
Jeremiah, thank you so much. This is all great information. I genuinely had absolutely no idea. Where can you find more information?
Share this episode with someone, with your friends, with your social media, and you can find more information if you want to learn more about the data at mytesi.com. That's mytesi.com. They have great resources and patient education and even education for providers. You also don't have to wait for your next checkup. You can connect with a healthcare provider via telehealth through the Mytesi website to see if Mytesi is a good fit for you.
Wow, I mean, this kind of blows my mind. I had also no idea that this was an issue, but it's incredible that there is something to actually help these people who are suffering. And I'm really grateful you brought this message for us to share to the community on such a wonderfully significant day, World AIDS Day. This is really amazing stuff to get out there.
Dolls everywhere unite. It's the call to Kiki.
This is the part of our time where we can kind of reflect on the show here, what we've learned or feel that we're more convicted about. Jake, what's your thoughts?
Yeah, I mean, well, for me, I have to say that I'm still in shock that this has been going on for so long. I'm going to try and share this with as many people in the community as I can.
For sure. Like, just hearing about this makes me feel like I just want to share this on my social media, my everyday life too, because like there are many people, there are many people who are gay. We're a small demographic, so we really need to share this message with people, post it on your groups online, wherever we can.
Yeah, and I get it. I mean, I know that this can be an awkward conversation to have, talking about diarrhea with your friends, but you might be really helping someone lose the stigma when you do. So when we own these issues, when we become vulnerable, when we speak out about them, out loud, we are taking the power back from the stigma.
I agree. That's right. And Gailey family, I just want to ask you to join me in thanking Jeremiah for being here, discussing this with us, and to Napo for their sponsorship of this episode, really in helping us uplift the community in another very demonstrable way. As always, family, we ask you to remember to love yourself. Like, take the time for yourself, and then turn around and love others when you do. And as always, don't forget to smile. Bye-bye.
Bye, baby.
Important safety information. Mytesi is not approved to treat infectious diarrhea. Before you start Mytesi, you and your doctor should make sure that your diarrhea is not caused by any infection from bacteria, viruses, or parasites. If infectious diarrhea is not ruled out, there is a risk that patients with an underlying infection will not receive the appropriate therapy and the cause of the infection may worsen. The most common side effects of Mytesi include upper respiratory tract infections, such as sinus, nose, and throat infections, bronchitis, which is swelling in the tubes that carry air to and from your lungs, cough, flatulence, which is gas, increased bilirubin, which is a waste product from the breakdown of red blood cells. Please see full prescribing information for Mytesi at www.mytesi.com.